Morning everybody, welcome to MedX channel. Today we are going to discuss abdominal examination and the site of the abdomen that we need to know what is the disease. Okay, don't forget to like the video and subscribe the channel. Let's start. This is the abdomen, and if we imagine that there is imaginary lines that divide the abdomen into 9 quadrants, like that. Those 9 quadrants, every of which will be named different from the other. Here it is the epigastric area, and this quadrant will be called left hypochondrial, and it is below the left the ribs, and this is the right hypochondrial. Here will be right lumbar, right iliac, umbilicus, and left lumbar, left iliac, and finally supra pubic. Okay, every of which will contain a different pain from the other. Okay, let's highlight those first. Okay, let's start with right hypochondrial. Right hypochondrial, here in the right hypochondrial, there will be the liver, okay, and gallbladder. And in epigastric area, there will be the right lobe of liver and stomach, pancreas, left hypochondrium, there will be spleen, okay. Right lumbar, there will be the colon, and umbilicus will be the stomach and colon, and here there will be some extension of the kidneys, right kidney and right ovary, and here right left kidney, left ovary, and colon also. And right iliac fossa, there will be if there is pain, there will be inflammation in appendix, and right kidney, right ovary, inflammatory bowel disease like Crohn's, suprapubic, maybe there will be the bladder, and also some part of the colon, and here would be the colon also, colon, left kidney, left ovary. So if I find any pain in in any quadrant of the abdomen, I will think of those organs to be affected. Okay, if we look at this picture here, this picture we divided the abdomen as I told you before, as here there is liver, right hypochondrium, liver, gallbladder, and right kidneys, and right lumbar region, which is here. There will be liver, small intestine, ascending colon, and right kidneys. The right iliac will be appendix, cecum, small intestine. Epigastric area will be stomach, liver, pancreas, and right and left kidneys. Umbilical area will be the stomach, pancreas, and the intestine and the transverse colon. Hypochondrial region will be small intestine, sigmoid colon, bladder, and left hypochondrial area will be the stomach, liver, left kidney, spleen. Left lumbar region will be small intestine, descending colon, and left kidney. And finally, the left iliac region will be small intestine, descending colon, and sigmoid colon. Okay. Let's look at this picture. If we find a pain in the epigastric area, we will think of esophagitis, inferior MI, myocardial infarction. There will be inflammation in lead 2, 3, and the AVF. This pain will be present in epigastric pain. This may indicate inferior MI, okay? And there may be gastritis and peptic ulcer, which is the most common type of pain, the most common cause of epigastric pain at all, gastritis and peptic ulcer, okay? The persistent gastritis and ulcer, the persistent gastritis will lead to perforated ulcer in the stomach or in the duodenum, okay? And finally, pancreatitis. And if we found a pain in right hypochondrial, it may be gallstones, as we mentioned that here is the gallbladder, maybe hepatitis, and here there is the liver, maybe liver abscess, or cholecystitis, or cholangitis. All of those can be happen in the gallbladder. Peptic ulcer may be present but rarely in the right hypochondria. Pancreatitis and costochondritis, and maybe also there will be subphrenic abscess, maybe from the liver or from the lung. And subphrenic abscess also will be found in the left hypochondrial vein. But also here, pancreatitis, splenic abscess, splenomegaly, splenic rupture, costochondritis. Okay, let's look at the right lumbar. Right lumbar, there will be the cause: renal colic, renal calculi, pyelonephritis, constipation, IPS, colitis, UTI, and Crohn's disease. By the way, the most common cause at all of abdominal pain, it is a non-abdominal pain, also called in another name, it is the IPS. IPS, it is the most common cause of abdominal pain at all. Okay, let's talk about the umbilical region. The umbilical region, there will be mesenteric ischemia, rupture, abdominal aortic aneurysm, small bowel obstruction, okay, constipation, umbilicated hernia, gastroenteritis, and early appendicitis. Let's talk about left lumbar region. There will be renal colic, renal calculi, pyelonephritis, constipation, IBS or colic, UTI, and Crohn's disease. Okay, let's talk about right iliac fossa. Right iliac fossa, there will be appendicitis, which is the dangerous and most common cause of right iliac fossa pain. Crohn's disease, ovarian cyst, ovarian torsion, ectopic pregnancy, hernia, right colic, renal colic, and pelvic inflammatory disease. By the way, there may be also mesenteric lymphadenitis, which is the most common cause of right iliac pain in the children. Mesenteric lymphadenitis, it is more common than appendicitis, but at all the right iliac pain may present appendicitis, but in the pediatrics, mesenteric lymphadenitis, which is the most common cause, which is the inflammation in the lymph nodes. Okay, what about the pelvic suprapubic area? Suprapubic area may indicate urinary retention, cystitis, pelvic inflammatory disease, endometriosis, menstrual cramping, miscarriage, fibroid, constipation. Okay, it is better to be male than female. Okay. Left iliac pain may present diverticulitis, colitis, Crohn's, constipation, ovarian cyst, ovarian torsion, ectopic pregnancy, hernia, and renal colic. I hope you got benefit from this lecture. Don't forget to like the video and subscribe the channel. Thanks for watching. Bye.